Hi, it's me again. I'm still a doctor, still don't play one on TV, but I do sometimes stay up 24 hours working, which is why I look like this. But this is what I choose to do in my spare time, which is kind of crazy if you think about it. Anyway, today's episode is called You Have the Right to an Attorney. You've all seen those television shows where the detective throws somebody up against the wall and they read them their Miranda rights. You have the right to remain silent. You have the right to an attorney. Oh, wait. You have the right to an attorney, and if you can't afford one, you will be appointed an attorney. Why, in America, the richest country in the world, why don't you have the right to medical care? And if you can't afford it, a doctor will be appointed to you. What a revolutionary concept. It might be because lawyers make the rules, but that's a story for a different day. So today I want to talk to you about Medicaid and Medicaid expansion. So first of all, I want you to understand that Medicaid provides care to a particular set of people. Children, look how cute they are. I don't know what their names are. I wish I did. The elderly, grandma and grandpa. The working poor, which means people who have jobs but can't really make ends meet because they're unskilled laborers or whatever reason. But they're working. They're trying, right? And the disabled. I don't mean this to be offensive to anybody. I don't know how to portray disability in a cartoon any other way. So I apologize. So when the Affordable Care Act, or what's commonly called Obamacare, was initiated, part of that included Medicaid expansion. Medicaid used to only offer services to those groups of people I just showed you if they lived at or below 100% of the federal poverty level, meaning they either made the maximum amount that could be defined as poverty or less than that. Those guys all got free medical care. Okay, but with Medicaid expansion, we expanded the coverage of that same group of people, grandma, grandpa, disabled, blah, 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 to people who fell at or below 133% of the federal poverty level. What does that dollar amount look like? Because those numbers don't make sense unless you put them into real terms. So here it is. The federal poverty level prior to Medicaid expansion was $24,600 for a family of 4, right? Once they expanded it so that people at 133% or less could get coverage at no cost to themselves, it was $32,700, I think that's a 7, $718. Not very much money. So FPL, just so you don't know, is federal poverty level, in case you didn't get that. So not very much money. So for this family of 4, if this woman or man, whoever was the head of household, wasn't lucky enough to work for a company that provided health care insurance for them, they would have to pay out of pocket. That would mean they would be in the individual market. The individual market is kind of like what I'm in, what I explained to you the other day, that for my family of 4, all of whom are healthy, I pay a yearly premium now of $18,000 with a huge deductible, right? $18,000 subtracted from $24,000 leaves about $6,600 left to live for the year. I don't know about you, but I don't know anybody who can live on that. You can subsist, maybe, if you eat out of dumpsters, but not out of pocket. So let's look at the counties and the places that benefited the most or the least from this Medicaid expansion. So in 2017, 100 of the poorest counties in the United States, out of those 100, there's about 45 or 50 of them concentrated in 5 states. Interestingly enough, in the state of Georgia, there are 24 of the poorest counties in the country. Right behind it is Kentucky with 9. Guess who lives in Kentucky and is the Senate Majority Leader? Mitch McConnell, right? 9 of the poorest counties in the world, or in the United States, are in his state. Behind that is Florida, then Missouri, then Texas, and then there's a smattering of other states that have some poor counties in them. It's an interesting correlation to look and see how many of those counties voted for President Trump. President Trump, who promised not to cut Medicaid. Remember that? He said, I won't touch Medicaid, I won't touch Social Security. Remember that, because that's important. In Georgia, 19 of those 24 poorest counties voted for President Trump. And in Kentucky, Florida, Missouri, and Texas, all of them voted except for Texas. Texans somehow are kind of smarter than us. 5 of the 7 counties voted for Hillary Clinton. So only 2 of the counties in Texas saw the handwriting on the wall. Okay, so remember that. So let's talk about Mitch McConnell's state of Kentucky. So in Kentucky, they have 9 of the poorest counties. And all of those counties have at least 28% of their population is receiving Medicaid because they're poor, right? That's who's supposed to be covered. We're supposed to be taking care of the poorest of us, right? 5 of those counties have greater than 40% enrollment on Medicaid. Nearly half of their county receives Medicaid for their health insurance. And one county, Wolf County, has the distinct designation of receiving 56%. 56% of the people who live in Wolf County are on Medicaid because they're really, really poor. Okay? Nothing wrong with being poor. I just want you to see where the dollars are going. So the people who voted for Trump, who promised not to cut their Medicaid, are the people who are benefiting most from Medicaid and who will suffer the most if Medicaid is cut. Right? So in Kentucky, in the period between 2013 and 2017, Medicaid and CHIP enrollment. So Medicaid is poor people, disabled, poor working, and elderly. And CHIP is Children's Health Insurance Program, which is also Medicaid. It just falls under another name. Enrollment went up by 105%. That is the largest insurance increase in any state. Mitch McConnell's home state took the greatest advantage, utilized those services more than any other state in the entire country. You would think the people in Kentucky would be up in arms, especially the people in those counties, right? That translates into almost 500,000 people that got additional insurance coverage under Medicaid. It was 488,000, but come on, they're big numbers. Let's just round up. And interestingly, half of those new enrollees were the working poor. The reason why is because most of those counties are in rural areas. And we know that in rural areas, you're more likely to have low income. You're more likely to be unemployed because there's less employment opportunity. You're more likely to have a disability. And you're more likely to lack insurance for all of the reasons we already talked about. Now, I work in an area where there's mostly white people. And I hear all the time that it's those lazy blacks, or it's the Mexicans that are coming in, or it's whatever other racial subset that you want to cast aspersions on and cast the blame on. Do you want to know who 90% of Medicaid recipients are across the country? Not just Kentucky, but across the country. 90% white people. Okay? So let's get rid of the argument that it's a racial problem. It's not a racial problem. It's an economic problem. It's an educational problem. It's a community problem. We're all interconnected. So this guy, oh wait, not that guy. This guy. Don't they kind of look the same? Look at Yertle the Turtle, and then look at Mitch McConnell. I kind of like that. Anyway, this guy is proposing a Senate healthcare bill. And that Senate healthcare bill proposes primarily to cut Medicaid. And he wants to cut it to levels that are even lower than before Medicaid expansion. So that means he doesn't want to just get rid of the people between 100% of federal poverty level and 133%. He wants to drop it to below people that earn 100% of federal poverty level. So remember that federal poverty level was about $24,600 for a family of 4. He doesn't want to offer Medicaid to them anymore. He wants to cut it even lower than that. Maybe you make $20,000, or maybe you make $18,000. I don't know how the world he thinks people are going to afford health insurance. And I really wish that he would watch my second video about Billy. And I want you to go back and watch my second video about Billy, the one that's titled, I Don't Want to Pay for Somebody Else's Health Care. Because remember, here's a guest appearance by Billy. Billy is our asthmatic who doesn't have any insurance and doesn't have money to afford a doctor's visit. Billy goes to the doctor's office, he looks at the door, and the doctor's office says, it's $100 for you to come in and for me to take care of you. Right? So Billy waits and waits and waits until he's so sick that he goes to the hospital. He's about to die, and he gets services from the hospital. And the hospital consumes resources. They pay the doctors, the nurses, they buy the equipment, they pay for the electricity and the machines. They rack up a lot of costs. And so the hospital sends a bill to Billy for $1 bajillion, which he still doesn't have. He didn't have $100. He doesn't have $1 bajillion either. So what happens is that when the hospital issues that bill and they don't get reimbursed, they jack up the rates for your insurance company, and then you wind up paying for it. And here's what's happened is that since the Affordable Care Act, the smaller insurance companies who have fewer patients, i.e. less negotiating power, they're not able to negotiate reasonable rates with a hospital, because the hospital says, look, you only have 1,000 people covered under your plan. I can afford to lose those 1,000 patients. Instead, I'm going to negotiate a contract with Big Kahuna Insurance Company who's got 100,000 patients, because I can't afford to lose 100,000 patients, but you can just go blow. So now you're in a situation like in Kentucky where there are currently only 2 insurance companies. There's a third one, but they're planning to leave the market at the end of 2017. So effectively 2 insurance companies. So here you've got 1 insurer, 2 insurer. That's who you get to choose from. And they both have really high premiums. So what's going to happen when Billy goes to the hospital and racks up that bill of $1 bajillion? That hospital is going to go back to 1 insurer, 2 insurer, and up their rates. And then the rates are going to go up for your insurance company, who turns around and jacks up the rates to you, right? Trickle down economics. Shit runs downhill. It's just like plumbing, okay? But when those rates go up, hold on, I gotta find the right picture. When those rates go up, this guy is gonna tell you that it's this guy's fault, right? It's Obamacare. Obamacare is the reason that insurance rates are going up. That's not true. Look at this. During the years of 2000 to 2008, insurance premiums did go way up. So this is pre-Obamacare era, right? Insurance premiums increased by 97%, or nearly double, right? From 2008 to 2016, insurance premiums went up, but they went up by 43%. So they grew by half the rate that they grew prior to Obamacare. Why is that? Well, the reason is because we had Medicaid expansion. So we had fewer uninsured patients, which meant that hospitals got reimbursed for the care that they gave, which in turn drove down your premiums, right? Relatively speaking, they didn't double, they only went up by 43%, right? So they grew at a slower rate because the hospitals didn't have to pass along that loss to you. That's what Mitch McConnell, or Yertle the Turtle, won't tell you, okay? They also won't tell you that during that time, when your premiums only rose by half the rate, you received more services. You couldn't be turned down for a pre-existing condition. You couldn't have lifetime caps put on you. Your kids could stay on your insurance till they were 26. You had to be able to receive preventative care free of cost. So you got a lot more services. And yeah, your price went up a little bit, but it went up by half because of Medicaid expansion. So the take-home message here is, for all those people living in those poor counties that voted for President Trump, who promised not to cut your Medicaid, pay attention in 2018 and in 2020, because you're the ones who are going to get screwed, and you're the ones who voted for this. I'm really sorry.